In 1998, my father was diagnosed with aggressive non-Hodgkin's large B-cell lymphoma. I know to tell you this exact medical diagnosis because shortly after that, I became the information officer for my father's treatment. I searched online for new treatments and research, talking to patients and caregivers and doctors around the world. The internet, which was already a huge part of my life, became a tool for me to help my father beyond all the care and nights spent at his bedside until he died in 2004. It is with this personal experience and my professional experience in the pharmaceutical and healthcare business that I can tell you that today's patients cope with their illness and interact with their medical providers in a very different way. And it is my belief that without true patient involvement, we cannot fix the healthcare crisis that is going on. There are a lot of metaphors relating to the doctor and patient relationship. I would like to offer a new one taken from the history of Israel. It was back in the 1950s when the question of the role of the Jewish Orthodox community in the new state and its army, a question of a lot of dispute. Our first prime minister, David Ben-Gurion, went to meet the Rabbi Chazon Ish, the leader of the Jewish Orthodox community. They sat down and tried to solve that issue. The story goes that the Chazon Ish wanted to convey the difference between secular Zionism and Orthodox Jews with a metaphor. He asked Ben-Gurion, what would happen if a loaded carriage meets an empty carriage on a bridge? Which of them should move? Ben-Gurion answered that the empty one should move. This metaphor, claiming that Jewish Orthodox are the full carriage with their heritage, belief, and knowledge, while secular Zionism is an empty carriage with nothing to contribute to Jewish culture, has long been an issue for much debate in the Israeli society. But this metaphor can also be told about the doctor-patient relationship. On the one side, we have the doctor, with his knowledge, education, and sense of doctors knows best, as a full carriage, and the patient on the other side as a helpless individual, waiting for the doctor to tell him what to do to save him, as an empty carriage. Inside the medical establishment, this metaphor has skewed thinking towards what doctors do instead of what patients need. But this metaphor is changing. Patients are shifting this equation, and the most notable enabler of this change has been technology. The internet was the biggest driver of this change. The expansion of it, the widening access to data, and breaking barriers to information has enabled patients to see what doctors know. Data from the Pew Research Organization shows that 72% of Americans now search the internet for healthcare information. In Israel, data shows that every Israeli that has access to the internet searches it for healthcare information. In addition, mobile phones and sensors give data and tools for patients to manage their own healthcare. Patients are now developing technology, using technology to disrupt the healthcare system. They better their experience while creating advanced tools to manage their healthcare. One story is the story of Maayan Cohen. A few years ago, she has acted as a caregiver for her partner in his fight with cancer. During his treatment, they had to manage a lot of documents and information from myriad points of care. This information, which was not centralized, was difficult, was inefficient, and disorganized. So after helping her partner with a successful fight against cancer, she proposed a solution, an app called Hello Doctor. With Hello Doctor, patients can scan their medical papers and turn those stacks of documents into an electronic medical record. This makes their data to be a material that is actionable, organized, and their meeting with their doctors become much more efficient. This is just one example of how patients are helping other patients become more engaged in their healthcare. But this needs to go even further. The medical establishment should understand that without a profound change how doctors see their patients, the global healthcare crisis will not be fixed. Doctors should stop seeing patients as a burden or a mere client or an empty carriage. They should be seeing patients as a resource. Like Dr. Charles Safran from Harvard said, patients are the most underutilized resource in healthcare. This view and philosophy is growing roots around the world. We hear more and more stories about patients engaging in their healthcare. One of these patients is Jenna. She's a young Canadian dealing with type 1 diabetes. In type 1 diabetes, her body has stopped manufacturing insulin, so she has to take insulin and adhere to a strict lifestyle. Because type 1 diabetes is incurable, but it is manageable, she looks constantly for new ways to understand what her blood sugar data is telling her. She uses tools like Charnoff Faces. This tool enables her to visualize her data and better understand it. In Charnoff Faces, individual parts of the face represent different values of variables by their shape, size, orientation, and color. So every face is a day in her life, and she can see those differences quite easily because humans can understand faces quite fast and notice every little change. She goes to the doctor, talks to her doctor about it, and together they make better decisions about her healthcare. Just like Jenna has taken the initiative to be more innovative and to be engaged in her healthcare, organizations need to take the same initiative, putting patients inside the process, listening to their new ideas and new insights. One such organization is an organization called Nesta, a non-profit organization from the UK promoting a concept called people-powered health as a way to fix the healthcare problems in the UK. A study they have done brings a lot of hope, saying that people-powered health could save up to £4.4 billion in healthcare spending, and that's just in the UK. They have produced a number of projects with very promising results, but they're not alone. The noted British Medical Journal has also changed and acknowledged the way patients help healthcare. So they've changed their journal to involve patients in the editorial and review process. They've also asked researchers, when they submit the research to the BMJ, to involve patients in the research design as well as the project. This is just one way we've seen of taking medical research from the ivory tower and back to the people. The medical establishment should understand that patients are no longer just passive participants of the healthcare process. They have ideas, added values, and need to be beside the table and not be ignored. Patients are not an empty carriage. Technology, which is a big driver of this new interaction, helps doctors and patients to revolutionize the healthcare system, and maybe we can heal it and fix it going forward. Thank you.